In the months following the Pretoria peace agreement, which aimed to bring an end to the war on Tigray, pregnant mothers continue to endure significant hardships, while the agreement has facilitated some progresses. The overall situation for expectant mothers remains dire. Many mothers report facing severe challenges in accessing basic health care services. There was no delivery equipment and ambulance service was unavailable. There was no enough medication. Many mothers were in shock, complicating their labor. The problem persists to this day. There is still no ambulance service, so people must carry pregnant mothers from rural areas. These mothers continue to face difficulties during pregnancy, and the issue remains unaddressed. There has been some progress since the Pretoria peace agreement. However, despite the availability of ambulances, fuel shortage continues. This forces pregnant mothers to travel on foot, with some even giving birth on their way here. These mothers face numerous challenges. Thus, the federal government and the interim administration in Tigray must prioritize and address the needs of these mothers. Head of Tigray Women's Association, Ababa Haile has drawn attention to the persistent challenge faced by mothers in Tigray, despite some positive changes since the signing of the peace deal. We have observed some positive changes since the peace deal. Healthcare professionals have resumed their duties, and mothers are receiving medication and labor services to some extent. However, significant challenges remain. There is no ambulance service, as the ambulances have been destroyed. Consequently, mothers in rural areas still need to travel several kilometers to access medical care. Without transportation services, these mothers face severe hardships and are at risk of life-threatening situations. In a recently concluded study, Dr. Tigrai, a leading medical researcher, reported a troubling trend in maternal health. The comprehensive survey has revealed that maternal mortality rates have experienced a recent increase.
We conducted a study involving a door-to-door survey of 190,000 households. The results indicate that maternal mortality rates have reverted to levels seen 22 years ago. We had hoped for improvements following the Pretoria peace agreement, but our expectations have not been met yet.
The concerned authorities at a federal and regional level are urged to prioritize maternal health initiatives and allocate resources to implement evidence-based interventions aimed at reversing the current trajectory.